what? A lot of women do not know they can have these before or premenopausal symptoms as early as age 30. In their 30s and their 40s, they can start having early menopausal symptoms. And I know I get a lot of women in my office asking me if these symptoms are normal. So I think that's a good place for us to start. How would you define perimenopause or those before menopause symptoms?
She's wondering if it's gonna feel like she's forever. Wondering if it's gonna feel like this whenever she leaves her safe space. She leaves her safe space.
So menopause on average happens at the age of 51. That period of time before where you start noticing maybe even just subtle changes in your mood, in how you feel, your overall health, that can be due to premenopause or perimenopause. And so I think we need to talk about it because we talk about it all day long with a lot of our patients.
Yes. You mentioned the average age, and I always go back to women's family history just to see when their mother went through their menopausal stage to help backtrack to give them an idea of when they may be experiencing some of these symptoms. You mentioned some of them, but what would you say some of the top symptoms women in this perimenopausal period experience?
Right. So a lot of people come in and they really sometimes don't even know how to describe it. So they don't know how to describe it. They're maybe forgetful about things, maybe some mood changes. They may have more anxiety, more depression symptoms. They may have hot flushes. They are not sleeping well. And these are really general, vague symptoms that can be pointed to a lot of different conditions. And so sometimes if you're in your 30s, in your 40s, when I get to see it a lot too, you don't really put a name to it because you're not thinking that. You're thinking, oh, I'm too young to be menopausal or perimenopausal. And so there's lots of symptoms, vague symptoms that we're not even connecting as women.
I would add to those two things that I see women often for, which I'm sure you do too, are the weight changes.
Yes.
Where they're doing the same workouts, eating the same foods, and they still aren't seeing those weight drops off similar as they used to. And then another one is the menstrual changes, where their cycles may be a little bit longer. They may be a little bit shorter. They may be a little bit heavier or lighter. And these are all things that are very common in this menopausal period. Some people don't complain about them, right? Because they're like, my cycles is 3 days. This has never happened. And it's light, but those are often changes due to the hormonal changes in their ovaries.
Absolutely. So one of the things too, we always have to keep an eye on. Some people don't menstruate. Yes. So if you have a progesterone hormonal IUD, if you've had an endometrial ablation, if you've had a hysterectomy, you need to be paying attention to this. You need to be thinking perimenopause is causing you to have all these changes to your body.
And so they come to our office, or they may even go to their primary care office and talk to their doctors, and they're wanting to know, what should I be doing at this stage? So is there a certain test that you get for the women or the patients who you see who are listing off these different symptoms to help diagnose or test for perimenopause?
Well, this is probably one of the most difficult things to address. People come in, they want answers. You may not be able to get answers through a lab test.
Right.
So when you look at FSH, which is the follicle stimulating hormone, we know that that's going to be pretty low in people that are still ovulating and still menstruating. When you get into the perimenopausal phase, it still may be in the normal range. It may be a little higher, but not considered abnormal yet.
Yes.
So that doesn't always give you an answer. Now, when you hit menopause, that FSH should be really, really high. But when it's in the middle, you don't really, it's really hard to tell. Yes. So another thing is that estrogen, the normal range for estrogen is so wide. So you may check it, it's in the lower range, but then another part of the month, it's in the higher range. So that really doesn't help you. You really need to be looking at your symptoms.
This is really important for our viewers to know, because I have so many women who come in and ask me, can you check my hormone levels? And I explain to them, it's likely going to be within a normal range. We're not always going to be able to diagnose a disorder unless your menstrual cycle has completely gone away and you're in that menopausal stage, because your body is going to fluctuate your hormones based off of certain stressors, what you ate that day, did you work out that day?
Yes.
You're going to have a different, depending on the day of the month, it is your menstrual cycle of the month. And so a lot of new research is asking us to check those hormonal levels around a certain day in your menstrual cycle, just so we can get a better depiction of what your hormonal levels, but still then it's not perfect.
Right. So I saw a commercial yesterday. You and I are going to do an experiment. Okay. There is this new product out that is like a pregnancy test, but you take it and you actually urinate on a stick, I think. I don't know the details. And you get to determine where you're at in the perimenopause or menopause window. So I'm curious, as a provider, does it work? Is it legit? So I think we should experiment.
I would like this.
You are way before menopause.
I'm one of those women in my 30s.
That's true.
And I'm experiencing those perimenopausal symptoms.
I am a lot closer, and I am noticing so many different subtle things about myself that maybe for the last few years I've been ignoring. And so I am very curious to see how our tests compare.
I like this.
And if they compare to what we're actually feeling and what we know as physicians. And I think that we should report on that next month during menopause month.
I would like that. Okay. We got some homework.
Yes.
You got to just let me know the name of this test. We'll get back to y'all.
I'll pick one up for you.
I got you.
Okay, Dr. Coates.
Oh, yes. Serious.
What are some treatment options? How can people treat these symptoms?
It really depends on what a woman's symptoms are when they present to the office. So first thing I'm doing is educating, because some women just want to know, is this normal? Because if they know that it's normal, sometimes we don't have to do anything. But I like to start simple. I talk about first lifestyle modifications. So that could be increasing physical activity. A lot of women focus on cardio, doing more strength-based training as well. We also talk about changes in our diet. So changing our diet from lowering carbohydrates to increasing protein. That can also help with some of the weight management things that some women may present with.
Absolutely.
You know, other things I talk to them about is just like overall lifestyle things such as yoga. That helps lower their temperature regulation centers. I also talk to them about meditation as a way for them to be able to decrease some of their potential stressors that they are having, help with some of their mood symptoms. Also helps with temperature regulation if hot flushes is an issue. We talk about simple things like changing the clothing that they wear, dress in layers, so that if they are having more hot flashes throughout the day, they're able to take clothes off, or having layers that they can put on if the temperature fluctuations is things that get to them, having a fan that they have in their room.
Yes.
You know, things like that.
This is so important, because in that early phase, you may not need to take medication, or you may not want to take a medication. You know, one of the things that we do a lot in our society is just kind of Band-Aid things, treat things with prescription medications that maybe that's not the answer. And a lot of women that come to me, they want to know some things that they have control over that they can modify. So when I tell people, you know, the best thing for treatment of menopausal symptoms or perimenopausal symptoms is exercise. That's the number one best thing that you can do for yourself. If you don't want to start a medication, if you don't want to put anything in your body, what is it that you can do? And that is exercise.
I absolutely love that. I really feel like a lot of women forget about that component of it. And also, they're reading or hearing things online that says that they have to be started on a medication or a supplement, or they're missing something. And we do have options out there available. And I feel like we should get into those, but also just looking at this is normal for you. And it doesn't mean that you have to get a prescription for it. Okay.
Right.
Yes.
Now, you did mention depending on what symptoms they present with, and we listed a whole bunch of different symptoms when you talk about mood changes. And you mentioned meditation, yoga, things like that. The other thing is there are some medications for some of those symptoms too. And we don't want to totally disregard those. Some people do need medications to help with their mood changes, their anxiety. And that is perfectly appropriate if that does have to be utilized.
Yes. I think it's always hard when you have a woman who comes into your office and they're telling you their symptoms. And me as a gynecologist, obstetrician, I prescribe antidepressants daily, even though I am not a psychiatrist. And I explain to them that the medicine I am prescribing could help with your perimenopausal symptoms. I am not saying that this is something you absolutely have to take, but there has been medications that have been proven for women who have gone through menopause. And so in my mind, if it helps with menopausal symptoms and you're having these same symptoms in your premenopausal phase, let's also start there if we feel like it could help us. And some women, it absolutely does. And I feel like that's hard as a gynecologist because you're not want to write someone off and say, this is what I think you should take because of your mood changes. But it's something that not only helps with mood changes, but it also can help with temperature regulation. We call those vasomotor symptoms of early menopause or menopause, and it can help with both.
Yes. The other symptom we talked about that is probably the most common reason why people come to us is that irregular period, that abnormal uterine bleeding. And that's a whole nother pathway of treatment, right? Because when someone comes in with irregular bleeding, our first thought is to rule out anatomical things, rule out uterine cancer. So we're going down that pathway that's separate from all the other symptoms that we're trying to address all at the same time. So getting an ultrasound, doing an endometrial biopsy, offering them hormonal medications that may control their periods better, or surgery could be the treatment option that is needed or is desired by the person.
I think another big one is vaginal dryness or painful intercourse. That's a big one that I get during this phase as well. And I'm always offering things simple like lubricants, right? Over-the-counter lubricant, something that you may have at home. I also talk to them about vaginal estrogen. I give women in their 30s vaginal estrogen. And I feel like people probably hear that and are like, no, if we have vaginal dryness and we know that this is a perimenopausal symptom, estrogen is what is decreased, that is not being made. Why won't we put the estrogen, which is going to help not only with elasticity of the vaginal mucosa or the vaginal tissue, but it's also going to help with the texture and the thickness of the vaginal tissue. And so putting it right back where it goes and it doesn't go all over their body. And so I say that in the office and women be like, whoo. And I'm like, vaginal estrogen will not only help with irritation with intercourse, but it decreases irritation and reducing your symptoms for vaginal discharge and having vaginal infections like bacterial vaginosis. And it also will cut down on your urinary tract infections.
That's a big one. Urinary tract infections. People do not connect those, but that is definitely important. Now that just goes to show you that perimenopause presents in so many different ways, in so many different age groups as well. And it's going to sneak up on you before you know it. So you've got to pay attention to it. Perimenopause, something that we need to educate ourselves about it as providers, because we didn't learn as much as we should because the data, it wasn't out there.
I know.
There's more and more data coming out now. So we're constantly learning about it. And definitely women out there, you all need to know about perimenopause. You need to like and subscribe. And we're going to be talking more and more about this as our channel goes.